Recently, in ophthalmic practice, we have been witnessing lots of cases of red eye disease. This is not something new. Every year, this kind of red eye disease has been happening. But this year, probably because of profuse rains in most part of our country, as well as too much of humidity in the atmosphere, this infection has come a bit early. Otherwise, this infection is not a new infection. But this year, more and more children and young adults are getting infected. And this is called red eye disease, pink eye flu, or madras eye. And in our medical language, we call this as conjunctivitis. So, the conjunctiva is a thin membrane which is present on the front part of the eye covering the white part. White part of the eye is called sclera. Covering this sclera, there is a thin membrane called conjunctiva. So, whenever there is an infection or an inflammation of this conjunctiva, the condition is called as conjunctivitis. Usually, this conjunctivitis is caused by a virus. Normally, this is called adenovirus, or it could be a bacterial infection also, either viral or bacterial. These are the common causative organisms causing this kind of infection or conjunctivitis, either viral conjunctivitis or bacterial conjunctivitis. So, how to differentiate between these two? If it is pure viral conjunctivitis, you find a serous or a watery discharge from the eyes. And if it is associated with the bacterial infection, then there will be a thick white discharge will be there, especially when you wake up in the morning. Your eyes will be stuck to each other, and you may have to use your fingers to separate the eyelashes or separate the eyelids. That is, they're called matting of the eyelashes is a common feature of conjunctivitis, especially bacterial conjunctivitis. So, what are the other signs and symptoms of this conjunctivitis? As I told you, basically this is an infection of the conjunctiva, so there will be redness of the eye. Eye will be profusely red, but one eye will be affected earlier than the other eye. And usually, this kind of infection, especially viral conjunctivitis, is bilateral. Both the eyes will be infected, but one eye will be affected earlier than the other. In addition to that, there will be thick discharge, especially in the morning. When you wake up in the morning, there will be thick discharge from the eyes and matting of the eyelashes, and you will have to use your fingers to open your eyelids. And next, you find foreign body sensation. Foreign body sensation in the sense you feel something like a sandy feeling, as if some sand particles have entered the eye, and this will cause a pricking sensation in the eyes. And irritation, burning sensation, and watery discharge, serous discharge, and sometimes thick mucopurulent pus discharge will be there in the eyes. And fortunately, in conjunctivitis, vision will never get affected if it is only a pure conjunctivitis. But sometimes, in addition to this conjunctiva, the black part of the eye, what's called cornea, central part, if that gets infected, then only the vision will get affected. Otherwise, in pure conjunctivitis, the eyesight will never get affected. So, how to diagnose a case of conjunctivitis? It is very simple. Diagnosis of conjunctivitis is very simple. In fact, no need to go to a doctor. Like anyone can. What I mean to say is, any person can diagnose a case of simple conjunctivitis. This is mainly because of the signs and symptoms. That is, the redness and discharge, pricking sensation, and usually this is contagious, and more than one person at home simultaneously, if it gets, if the eyes become red, then usually it is nothing but a viral or bacterial conjunctivitis. So diagnosis is very simple. And treatment is also very simple. usually it is self-limiting. If the infection persists for more than 1 week, then only you'll have to go to an eye doctor. Otherwise, within few days this virus infection usually gets subsided, it will go on its own. If it continues for more than a week, then one has to see a doctor. And especially when the eyesight has reduced, in addition to the symptoms which I mentioned earlier, if the eyesight has also reduced or the vision has reduced, then one has to consult an ophthalmologist. Or otherwise, a simple case of conjunctivitis, it will subside on its own. Even though the conjunctivitis is very simple, uh, it is highly contagious. Especially if it is viral conjunctivitis, it is highly contagious. And if one person gets infection at home, if it is viral conjunctivitis, invariably it will spread to others. And if a child at school gets infection, he or she will spread this infection to other children in the class, or even to other staffs, the teachers and all in the class, in the school. So if a child gets infection, conjunctivitis, better not to send the child to the school for at least few days, like for 5-6 days, or until the eyes become normal. And even for adults also, if the conjunctivitis comes, then better not to go to office. And nowadays there is a fashion of work from home. Better to get this work from home policy until the eyes become normal. Otherwise, there is a high chance that you might spread this infection to your colleagues in the office. So this spreads mainly by physical contact. There is a misconception that if you look into the eyes of an infected person, or if a person has got this conjunctivitis, if you look into his eyes, you will get this infection. Actually, this is a misconception. This is a myth. It is absolutely wrong. Just by looking into the person's eyes who has got infection, not necessarily you will get this infection. It is not by looking into the eyes. This is mainly by physical contact. That is by using towels, by using stationaries like pens, pencils, erasers or books, etc., used by the infected person, or even handling the doorknobs, bath towels, handkerchiefs. Through this, the infection usually spreads, and not merely by looking into the eyes of an infected person. So the best thing is uh, adopting the hygiene. Good hygienic conditions are very important. After touching your eyes, better to wash your eyes with the soap and water. Nowadays we all know the importance of washing hands with the soap. Especially after this corona, we all know the importance of using hand washing your hands with soap. So at least 15-20 seconds you have to wash your hands nicely before touching your eyes. So hence, by doing like this, you will reduce the chance of spreading this infection to others. And one more thing is that if you are a contact lens wearer, better not to use contact lens for at least for 7 days, or until the eyes become normal. Once the eyes are normal, then you can use the contact lenses. Until then, you will have to use only spectacles. And even after the infection subsides, you better to dispose those pair of contact lenses, and better to use a new pair of contact lenses. And better to avoid swimming. When the infection is there, when the conjunctivitis is there, better to avoid swimming until your eyes become normal, or at least up to 7 or 10 days. And another important thing you have to follow is sharing things like sharing eyeliner, makeup set, or mascara, or any kinds of cosmetics. Better not to share during the course of this infection. This is because this infection, as I told you earlier, this spreads mainly by physical contact. And many people wear sunglasses during this infection. Actually, wearing these sunglasses has no role to prevent infection or prevent spread. This is mainly to avoid touching your eyes. For example, if you wear sunglasses, your chances of touching your own eyes is very less. So in this way, the wearing of contact lens, wearing of sunglasses, it helps. But if wearing sunglasses doesn't prevent spreading of infection. This is like a blind person carrying a lantern. This is just to know that no others that this person is blind because he is carrying a lantern. Similarly, sunglasses uh, have no role in preventing the spread of infection. So treatment wise, as I told you, this is a simple infection. Usually it subsides on its own within 7 days or 10 days, and if it continues more than that, better to consult an ophthalmologist. And if you consult an ophthalmologist, he will prescribe some eye drops like antibiotic eye drops, decongestant eye drops, and moisturizing eye drops, or sometimes oral tablets, oral preparation like anti-inflammatory medicines can be prescribed. This will reduce the complications of conjunctivitis. Otherwise, it is self-limiting. This will subside on its own within few days. Anyway, this is not a conjunctivitis is not a serious problem, but nowadays it is spreading like anything. And even though it is not a serious problem, better to take proper precaution to prevent spreading of this infection. Thank you very much.